With the passage of President Trump's big, beautiful bill, there are lots of questions surrounding cuts to Medicaid. 3.4 million people in Illinois are on the taxpayer-funded medical program. And Governor J.B. Pritzker estimates under the new bill, 330,000 will lose coverage. Peter Hancock, a reporter with Capital News Illinois, joins us now. Thanks so much for sharing your time with us, Peter.
It's good to be here. Good morning.
Well, we got a lot of questions about this. When are Medicaid enrollees expected to learn that they will lose coverage, and how will they be notified?
Well, that's yet to be decided. It will be over the course of the next couple of years. The new law brings in a number of new regulations. It primarily affects people who enrolled as part of the Affordable Care Act's expansion group, or Obamacare expansion group from 2010. Those people will have to go through what's called a redetermination process, not once a year, but twice a year. There are some additional requirements for people. They're going work requirements for people in that group. So they'll really need to pay attention, watch their mail, watch their email for any notifications that they need to turn in additional information to either the Department of Human Services or the Department of Healthcare and Family Services, wherever they get their Medicaid services from, and make sure that those forms get filled out.
You know, there's been a lot of focus on the elderly, the disabled, those taking care of the disabled, single moms. Are any of those people going to lose coverage?
You know, it's hard to tell which groups in particular are going to lose coverage at this point. I think a lot of the fine details of the bill and the impact that it has, it's going to take a little bit of time to shake out. There are no particular rule changes in terms of those kinds of eligibility groups. Really, it's a lot of paperwork that people are going to have to fill out to verify their employment, to verify their continued eligibility in the program. That's, I think, where the major impact is going to fall. It's also, according to independent analyses, the biggest impact, I think, is going to be in rural areas, primarily because that's where you see a larger percentage of the population that's covered by Medicaid. As you mentioned, overall in Illinois, it's about 3.4 million people. That's about 1 in 4 individuals in the state of Illinois. Medicaid pays for, about 40% of all the childbirths that occur in Illinois. It pays for about 69% of all the nursing home care in Illinois. So, in terms of actual eligibility, you may not see a lot of changes, but anytime, nationwide, they're taking $1 trillion out of the healthcare sector of the economy. So it's going to have an impact on the healthcare sector. Some people are saying it could result in hospital closures, clinic closures, or cutbacks in services that are available, those kinds of things. So it's really it's going to take some time to shake it all out.
Okay. All right. Thanks so much, Peter. We appreciate your feedback this morning on the topic.
Thank you.